Welcome to a special episode of the Small Business Saturday with Scottsdale Vibes. I'm Alicia Haygood. We love our small businesses here in Scottsdale, and as we all know, we thrive with them. We need them. They are a building block of our economy, and I'm so excited to feature our amazing small business with Scottsdale Plastic Surgeons and Dr. Paul Holden today. So we are going to dive in, and we want to talk about all he does for health, wellness, innovation, and aesthetics. And we're really talking to one of the experts with Dr. Holden of Scottsdale Plastic Surgeons. He is a double board certified facial plastic surgeon who specializes in face, nose, and neck. He's nationally recognized for his expertise in rhinoplasty, complex revision surgery, and innovation facial rejuvenation techniques that really deliver that natural looking feel that all of us are going for. Scottsdale Plastic Surgeons is one of the best and top aesthetic cares from the top of your head really to the bottom of your feet, with more than 10 years of this team together, and some of them have even been together for more than 15 years, which really goes to show how well they are connected and work together. They have an esthetician as well as nurse practitioners to really dedicate yourself to all of your health and wellness, from hormone balance, weight loss, and peptides for maximum health. They pride themselves in the quality care of their patients, safety, natural results, and an easy, enjoyable experience. So I'm so excited, Dr. Paul Holden. Thank you for joining us today. I am excited to get to know you because as we were kind of talking before we jumped on, everyone picks their plastic surgeon because we want that connection with them, right? We don't just, yes, we want your skills and yes, we want your knowledge and everything, but your bedside manner, how we get along really matters when we're picking someone to work on us. So I would love to talk with you and just kind of dive in. For you, what made you choose the route of medicine and then really get into the plastic surgery side of medicine?
That's a good question. So my story is kind of a funny one. When I was very small, like 2 or 3 years old.
Oh, wow.
I just liked doctor stuff.
Okay.
I liked the mask. I wanted the gloves. I wanted the coat,
long white
white
coat.
Yeah, I wanted all. And so for many Halloweens, I was a doctor. And the adults are so encouraging,
Right.
Oh yeah, I could be a doctor.
Doctor, lawyer, that's what we all want to be, right?
Yeah. And as time went on, I really did want to be the person that people came to when they needed help. I wanted to be, is there a doctor in the house? I want to be able to raise my hand, but I really had no specific ambitions. I got into athletics and in high school and college, and I thought, oh, I could be an orthopedic surgeon,
Oh, yeah, that makes sense, yeah.
So when I started medical school, I did some work after college. I worked in clinical research, primarily on the virus that causes HIV, and I had a master's degree in molecular biology, and so I started working on the quantification methods and detection using really advanced PCR techniques. You hear about it now with COVID, but in the mid-90s, it was brand new,
Yeah.
and it was actually a cumbersome thing to do. It was difficult, but I had been doing it, so I took this job in this lab and we worked on it, and we actually were directly involved in the approval of the first drug that really changed HIV from a death sentence to a chronic manageable
That's amazing.
illness.
That's incredible.
Yeah. And so it was great to be part of that and to be on a big project, work with big drug companies, but it only solidified my desire to work in medicine. So once I was there, I still thought I was going to be an orthopedic surgeon. I started doing research in it, and when you're even in your first year of medical school, you spend time with...
You do rotations throughout everything.
Yeah, they're not quite rotations in the first 2 years, but you do get time with different teams if you want to.
Okay.
And so, of course, I was volunteering a lot of time to help out the orthopedics team because I wanted to get into a good program. But I just realized quickly it wasn't my thing. Orthopedics is a lot like woodworking or construction.
Okay.
There's a lot of hammering and sawing and
If you
drilling
say, yeah.
and all that.
God.
And I'd worked in construction. I worked with wood. I'd done all that before. But it just seems sloppy and gross, and you have to wear a lead vest the whole time, which is hard on your back, because there's a lot of x-rays used in the operating room. So I kind of had a crisis of identity, and I started looking around, and believe it or not, it was pure serendipity. I went into a case and saw one of the really old masters of rhinoplasty do a nose at the county hospital. And he was really already retired, but he had authored many of our textbooks and things like that. So I got to see really
real life.
beautiful work.
Yeah.
And you can see the transformation as it happens. And so that was at the moment. I asked him right after, what's the path I should take? He gave me good advice. I followed that advice, and here I am.
I love that.
Yeah.
So how long have you been in rhinoplasty at this point?
Oh, well, facial plastic surgery, which includes rhinoplasty, facelifts, eyelids, everything, to about over 20 years.
Okay.
I've been in the Valley here since 2010.
Okay,
so-
that's what I was going to lead up. But I mean, Scottsdale's known for our aesthetics
Sure.
and our health and wellness. We love it.
Yeah.
Why Scottsdale? For that reason, and how do you help stand out? Dr. Holden in Scottsdale with your specialty.
Yeah. So Scottsdale was primarily, I'm from California. I didn't want to go back to California. I felt that, having lived there, it's very expensive and it's hard to operate there. And so I looked at other places, and I have family out here, so I thought, well, I'll come out. And when I came out and kind of looked around, I realized that it was a very plastic surgery positive culture. In fact, it's one of the 5 plastic surgery meccas of the United States. And so I thought, I want to be in that. I want to be in the competitive mix there. It's actually, like, from a business standpoint, you'd rather have the 4th gas station on a corner where there's already 3 than have the 1 gas station alone on a corner.
Okay.
People will think the other way, but it's just a truth that people know that intersection that already has 3 gas stations is where you go to get gas.
True. Okay.
And studies have shown that the 4th gas station actually causes all 3 plus their own revenues to be higher. So if you're in a place where people know they go for plastic surgery, you at least have a better chance in that environment.
Interesting. That makes sense.
As far as competition and setting yourself apart and everything, initially, when I first got here, Groupons were a thing, and I did some lasers on a Groupon and sold way more than I thought I would, and so I instantly had a huge, throughput of patients
clientele,
to
yeah.
meet, and a lot of them got surgery, and that kind of got me off and running.
Okay.
It's not a moneymaker to do those things, but back in the day,
Start,
it was sort of a reverse marketing. You pay after, not you pay with your labor.
Let's talk about you are double board certified.
Yeah.
What does that actually mean? Because it sounds really fancy in a lot of school, and I know it is. I did not take molecular biology in class, so really talk about what that means, because that to me just puts you on another level as well for standing out for your specialty.
Yeah, it does. So board certification, if you're going to quote it, is if you're going to say I'm double board certified, you're referring to there's an American Board of Medical Specialties, ABMS, and that board recognizes the specialty boards.
Okay.
So there are unrecognized boards, but if you're in a recognized board and you say you're double board certified, that means you're certified by 2. As a surgeon, I'm certified as a head and neck surgeon, as well as facial plastic and reconstructive surgeon. So that means I did a full residency in head and neck surgery, and then some subspecialties or added specialties. This isn't a subspecialty; it's a separate board. Requires you to have completed at least head and neck surgery or general surgery, and I chose head and neck because, and I did a program in Orange County that's very plastic friendly.
Yeah.
Because you're already doing a lot of plastic surgery with the head and neck, even if it's someone who got trauma from an accident or from a gunshot, to cancer reconstructions, and then even just aesthetic cosmetic surgery. It's still 25% of the head and neck surgery training. So you're really just adding on to that with the fellowship.
That's amazing. Yeah. And it matters, because I feel like the more, like everything, the more you do it, the more your skill set becomes an expertise in that kind of field.
Right. So for the board certification, for each one, you have to meet the criteria to even sit for the exam, which usually involves a residency or a fellowship. And then you sit for a written and then a oral exam, and the oral exam is pretty in-depth. Like there's drawing, and you have to sit face-to-face with high-level people in the board, and they run you through cases and check your judgment.
Yeah, because you have to make those decisions on the fly sometimes in the OR.
Yeah. And then to maintain that now, we have to do what's called the MOC, or maintenance of certification. So that involves recurring tests, recurring things. So someone who's double board certified is doing that for 2 boards, and as well as maintaining the quality of work and reputation that the board can get behind.
That's awesome. I love that. And thank you for doing that. It means a lot to the patients and stuff. All right, let's talk at the beginning. I'm interested in coming in to talk to you. I am interested in some kind of face, neck surgery. I'm nervous. I don't know what I want. Calm me down and talk to me. How would you start this process of a new patient from beginning to your decisions and working with them to really create this one-of-a-kind package for your patient?
Sure. So every patient that has already gone through the process of just being scheduled and everything, they usually are pretty nervous, which is funny. So I always usually kind of make a little icebreaker, but I like to tell them, relax, I'm not going to cut you. I might later, but not today. Not today.
Yeah.
You know, just make a little joke out of it, because they really are nervous. Really, the nerves come from the fact that when we want to talk about things that we want to improve, we're also talking about things that we feel that we hold very closely personal to
Insecurities,
ourselves.
right, vulnerability.
Yes. So it's hard to share that. So I do make sure to tell people, hey, all of us get it. We get it done to us. We do it. It's our stock and trade. You can tell us anything. We will be totally unfazed.
Right.
We've heard it all. We've said it all.
Yeah.
And we both get and want more plastic procedures or cosmetic procedures to keep us looking good. So you can relax. You're among friends.
Yeah, that's true. Yeah.
Yeah.
Let's talk about how you really do create this one-of-a-kind package. We can go through and see the before and afters of your
Sure.
work, and we can do that with a lot of surgeons. Most people are like, oh, I want it that nose. You can't get that nose for your body. How do you talk to someone and set realistic expectations for what they're looking for?
You know, most times people know what they don't like.
Fair.
There are young people that will come in with pictures of influencers and things like that, where they'll say, I like this nose, I want this nose. And I will tell them, like, it's a good sort of general guide as to what you want, but your version of that nose is going to look a little different. The best way to kind of navigate that is to show them, based on what they don't like and kind of what they want to improve with computer imaging, how that's going to look. So that's an important step to both get them to figure out what they do like on
Right.
their own face, as well as what they don't like, and develop a model for a plan. So the imaging is part of the process, because we're going to develop a shared goal, and we're going to visualize that, so that when you're asleep, I can look at the imaged photos, and it's like you're right there telling me, this is what I want.
I love that. Let's talk a little bit about that. Imaging is huge. Talk about how technology is changing in your field and how you're incorporating that into your practice.
Yeah, you know, you never want to be the first to adopt new technology, and you don't want to be the last, you know?
I like that.
So,
I've never thought about that, but that's very true.
You don't want to be the first when it comes to medicine.
That's true, yeah.
So usually when something new comes out that's going to be potentially incorporated into my field, the first thing I do is talk to colleagues and see what they've done with it and what their experience has been. That's usually done at national meetings. So I attend our national meeting every year.
Okay.
This year it's in Vegas, of all places.
Oh, nice.
But, you know, we had it in New Orleans.
That's much more fun, I will say. I mean, you're in a room all day typically anyway.
Yeah. Most of the time you're in meetings all day.
Exactly.
And you're not out there having fun. Vegas, you might be able to find some trouble. But if you go to the meetings and you know your colleagues in both academia and in private practice, you can have free and open discussions with them about what their experience is with X, Y, or Z. As an example, there was a device that came out that used ultrasound as a facelifting technology, and you know, it sounded very promising. Pretty expensive device, pretty painful for the patients. Early results looked promising based on the photos from the manufacturer. However, I personally and my colleagues were very underwhelmed by it.
Okay.
And that's partly because if you understand what goes into actually lifting tissue, hitting it, burning it with ultrasound or radial frequency or any of that stuff is not going to do what a lift does.
Right. It's nothing permanent in that sense.
Yeah.
It makes sense.
So it's better to talk to your colleagues, kind of do your own research, look around, look for results, try it out if you can borrow one. So that's kind of the usual tack I'll take. It's similar for techniques. You know,
Yeah.
you can see changes in surgical techniques. They'll show it up on the big screen and they'll say
Yeah.
that I do this now. But you might want to do a little more digging before you start trying that on your patients.
Interesting.
You
I
know?
never thought about the technique in general. I mean, that's advancement in technology and how we
Yes.
use and the new tools that are coming out and everything. What are you excited about with the future of the technology where it's going right now?
You know, I think that
I'm going to interrupt you and ask follow up with this. So much of surgeries now are robotic and stuff like that. There
Yes.
is still a skill set to the doctor needing to be there. So how, with the future of technology in the OR and your hands still needed, how are you working together with that to still be the surgeon?
the robotic stuff is usually for solid organ work.
Okay, so it's not more, yeah.
In a body cavity, there's a lot of space. Things can move. Basically, facelift, rhinoplasty, all these things they're really commissioned art.
Good,
And,
yeah.
and there's nothing that a robot can do, even if you're controlling it, that would be superior to what we do. And that's
Love
because
to hear that.
just the nature of it. For example, the facial nerve. If you're going to do a deep plane lift, you have to lift the layer, which is muscle and fibrous tissue that's over that nerve. There's a little bit of investing tissue there that protects it, but it's right there. The nerve has varying routes of paths, so it's not the same on every person how it branches and where they are.
So you can't,
But you have to have you have to have a level of sophistication to be able to recognize it and either retrograde trace it or trace it out. You know, as they say, a good surgeon identifies the nerve, a bad surgeon runs into it. So
okay, ouch, yeah.
technology is, as it stands right now, even with AI, you're looking at things that are sophisticated at information gathering and presenting it to you. They're also using predictive technology to try and predict what you would like. But in the case of surgery, there's so much constant reading and rereading of the situation and you have to constantly adapt, that I think the scenarios are just too varied for it to be involved at this point. For example, if someone had a permanent filler, something like Bellafill, and they had it in their cheek, and you're dissecting through that tissue, you're going to encounter the Bellafill, and it makes the tissue have a very different character. And the patient
can feel that as a surgeon.
You can see it and feel it,
right.
and the patient may not have told you that they've done that. So in a lot of ways, it can look almost like the patient has cancer when they don't.
Oh.
And you have to be able to recognize the difference.
Yeah.
And I just don't believe the technology is anywhere near that. On top of that, if they have prior surgery, there could be scar tissue, distortions of tissue anatomy, and things like that. So at this point, I don't think anything in the plastic surgery realm is currently under pressure by robotics or advancement in AI. If it were to come along, I would welcome it, of course. But people will always want a surgeon who's responsible for the work to be there, just like you want a pilot on the plane.
Yes.
The planes fly themselves now.
But you still have the
But
pilot there.
you want that person there because it's an equal opportunity killer. They're going down with the plane. They have an interest in surviving.
You mentioned this. I want to dive a little bit more into it. You mentioned that combine art and medicine with these,
Yes.
and I think that is very much. I mean, we are your muse. You know, we are your art. Talk about how combining those really is a skill set and how you use that in your practice.
Yeah, I think, you know, I've trained surgeons, and I've obviously been trained. My background is that I was always really into art. I was sculpting, drawing, painting, doing woodwork, wood art, even some metal art. And if you have an artistic ability and you go through the process of medical education and surgical training, I think you're well positioned for this profession. There are plenty of people who have no artistic ability, and they basically try to use mathematical ratios.
Yeah.
Things that are as old as Da Vinci's work that describe proper ratios between the spacings and sizes of things on the face that lead to what we perceive as beauty.
The art. I mean, what's the picture where the body's on there and you have all the circles and everyone's perfectly asymmetrical and stuff like that.
Those ratios. People get into the golden ratio and all that, but all of it is part of trying to crack the mystery of art, when in reality, for someone like me, of course I know the ratios. I'm very mathematically minded, but I look at someone as they are, and I can see the possibilities in them, and I can already know the route I'm going to go there to get it.
Yeah.
At that point, for me, it's more of preserving your identity,
Yeah.
accentuating the things you have, restoring the things you've had that have maybe started to show signs of age, just so they can be better featured without looking done. So that's got to be art. It's not mathematical.
I actually love that. That's really nice and beautiful sounding. With that, do you feel that people are going more towards a natural look and not more of a done up procedures that we've kind of seen in the decades past?
It's funny. I think the majority of people do want natural look.
Yeah.
There are people that want the sort of Real Housewives look,
Yeah.
the done look, the exaggeration of the lips, or the super tiny nose, or the very tight face, and things like that.
Yeah.
But overall, most people don't want it to be obvious
Yeah.
that they've had work done, but they do want to see a big difference. So that
It's a
if you think
catch-22
about,
almost, yeah.
well, it seems like it, but there is the only way you're going to navigate that is having an eye for what would look natural in this person. And so I can tell you, like, it's going to sound bad, but in training surgeons, if they have A+ manual dexterity, A+ book smarts, and C+ artistic ability, they're generally going to get C+ results.
Huh.
And you can have B- manual dexterity and B- knowledge and A+ artistic ability, and you can still get A+ results. Of course, it's better to be all A's.
Right.
And that's my thing. I'm a 4.0 guy. But,
But that's interesting. I never really thought about that. You can be taught the skill set, you can be taught the book smart, but visually being able to see the results, that is a different skill set to match up to the patient. Yeah.
Yes.
I like that. Let's dive into some of your skill sets that you've talked much about it, rejuvenation procedures. Kind of dive into what specifically that is. And then I want to ask you, follow up with the ponytail upper facelift is, because that's one of your specialties as well.
Sure. Rejuvenation in general is anything to restore a more youthful look.
Okay.
It's not necessarily to, say you're going to look X number of years younger.
Right. Take off the decades. Bring me back to my 30s.
Yes, but it's to look good for your age.
Okay.
And so I like to tell people that right off the bat, because sometimes they'll come in with some really old black and white pictures. It's like, here's me when I was 26. And I was like,
"You're
oh,
very
yeah.
pretty."
Were you going to a concert for Elvis Presley, or what was happening?
I get it.
And so, you don't want to encourage that concept, but the idea is to restore from the effects of aging. And so that from top to bottom can involve forehead lift, brow. You can sometimes do, for people with high foreheads, hairline reduction, which is a forehead reduction. Eyelid surgery like blepharoplasty, those kinds of things. Fat transfer for people who've lost volume from their face, which happens with age.
Yeah.
And skin resurfacing. And then, of course, the big ones, which would be a face or neck lift.
Yeah.
And there's a big market out there. There's a lot of misunderstanding about what is a facelift, because that word, facelift, is misused a lot.
Okay, interesting. Because I agree. Everyone, when I think of a facelift, it's what I grew up in, 20 years ago, where everything's just getting tightened up, and you see everyone taped back and tied up in gauze when you get out of surgery and stuff like that. But it was like one kind. I feel like it was all or nothing.
Yeah, I think now because of what I call bundling, like there's practices that will say you need a full facelift. And what they're saying is, we're going to do a forehead lift, your eyelids, some fat transfer, a facelift, and maybe some laser or chemical.
Yeah.
So they'll call that a full facelift. But in the textbooks, a facelift is lifting from the cheekbones to the collarbones.
Oh.
So it's this area. And so it really is just the face and neck. It's for jowls and neck bands and things like that. And so when people come in and I say, I have to call it now a lower facelift, because so many people,
myself included,
think a facelift is the whole gamish.
Yeah.
But it's not. It's technically this part.
Okay.
I'm always going to push back against
Good. I mean, I literally
misuse.
thought that's what it was.
Yes,
So if you
yes.
hadn't said that, I would have continued on thinking that.
But I think it's kind of a way for practices to try and sort of push people into the bigger ticket and say, well, you really should just do your full facelift. You need a full facelift. But when I look at people, I prefer a tailored approach, partly because that's the right thing to do. You don't want to do unnecessary surgery. But also, if you ever want this patient to see you again, then you want to make sure you do a nice job. And let's say they don't need a forehead lift today. They might need one in 5 years.
Yeah.
So you just tell them that.
Yeah.
You know, at least I do. I'll just say, you know, I think your forehead's okay for now, but maybe in 3 to 5 years, we might want to revisit that.
Yeah, I like that.
You know, that kind of thing. So that way they're not having to go through this massive procedure with a much more difficult recovery, and they can just direct their energy and their money towards the things that are really need attention right now.
And so let's talk about you, the ponytail upper facelift. Talk specifically about this with what you do with your patients.
Yeah, the concept of the surgery is basically to give someone the look of like a tight ponytail.
Yeah.
Which gives you a brow lift, and it gives you a little bit of tightness here in the upper cheek. So
as I feel my eyes and I'm there.
So because a lot of times, sometimes the tail of the brow really starts to slope down.
That's definitely with age.
A brow lift tends to be in the central forehead here, which is kind of, you know, between the midpoints, or maybe a little outside the midpoint of your eyebrow up. So if you really want to get it all, you have to do a little lifting from the side. So I make an additional approach on the sides here, where we can bring that up. It's usually for someone who's in their, you know, mid to late 30s to mid 40s, who hasn't had a lot of lower facial aging, but is seeing it up here, and they may or may not want to do their eyelids with it, but usually they're starting to, you go through a lot of Botox, and when they get Botox, they feel like their brows are too heavy. That's the group that needs to come in and look at either a ponytail lift or a forehead lift, depending on their particular shape.
Okay.
People like the ponytail lift because it's sort of a nice bridge to get you a little ways before you need the real deal, the facelift.
Okay, that makes sense. Let's talk about nose. We have a lot of breathing issues going on, a lot of people on the CPAP machine and stuff like that. But let's talk about it with you specifically, because there's a lot of issues that we could fix with our breathing issues and our better sleep and lifestyle just by fixing, you know, our nose.
Sure.
So talk about that going into helping patients for not always cosmetic, like looking better nose jobs.
Sure. There can be, and there often is, a bit of a functional, what we call a functional aspect to rhinoplasty, where you want to improve their breathing, or if they have recurrent sinus infections. If they have a septal perforation, not in every case, but in most cases I can get that repaired. Those kinds of things, you know, you want to look at those. You know, I do look at them, and I can treat them.
Gosh, I go back to thinking about when you were in sports, how many broken noses you probably saw, and like
I had, you know, this isn't my original nose. I had to get it fixed.
Had broken nose,
yeah. I had
thinking
to get
about
it fixed.
that,
yeah. And so you do see your share of people who have had trauma or had prior surgery and there's damage, or they just have conditions that, you know, they were either born with or developed over time that cause issues in the nose. So not every functional problem with the nose can be addressed with surgery, but many of them can.
Correct, yeah.
But your reference to CPAP, which is to help you breathing, you know, because people will start to obstruct when they're sleeping, it's kind of a condition that almost everybody eventually has to deal with. And it's because we are a speech-oriented people, right? We're evolved for speech. Our voice box is very low in our neck. So between where our voice box is, which is in the low neck, and where our breathing happens, there's a lot of soft tissue there. So there's, most importantly, the base of the tongue and the soft palate and the tonsils.
I'm like feeling everything in my mouth as you're talking.
Yeah, they're all back there. And so if you're laying on your back and you fall asleep, that tissue can relax. When you're young and everything is taut and has good tone, it doesn't cause an issue.
Right.
But the stereotype of grandpa snoring on the couch is because that tissue's gotten floppier. And so many times it may not be fixable with external airway surgery like rhinoplasty. There's a common misconception that it would help, but it can help with CPAP. CPAP can go from as far as having like almost a Darth Vader mask.
Oh yeah.
All the way to just a small little nasal thing or little nasal
Like
plugs.
almost an oxygen.
Yeah, the little, what they call nasal pillows, you just put them in your nose. So people who have trouble breathing through their nose who have sleep apnea, they benefit if I repair the nose so they can breathe. But most of the time, I'm always, because I don't take insurance, I'm not on network or anything like that. Most of the time what I'm doing is a combination of cosmetic and functional work. Sometimes it'll be strictly functional, but most times it's combined. Yeah.
So let's talk about what does functional nose procedures look like? Again, I think it goes back to that's a very artistic skill.
Yes, you want to improve it. You want to improve the appearance and improve function. And oftentimes they seem mutually exclusive because you want to make a bigger nose smaller, so that how does that make it breathe better?
Right.
And a lot of times, what we see outside is not a representation of what's going on inside.
Correct.
Believe it or not, your nasal cavity is about 7 centimeters deep. And it goes straight back to your throat. Right? All along that way, you can have deviations in the septum. You have these structures called turbinates, which are a big part of humidifying and warming the air as you breathe. They can get enlarged and in the way. And you have the sinuses, which can develop disease themselves, and you could have polyps and other things causing obstruction. Sometimes it's just developmental. Sometimes they grow a big spicule of bone in their nasal cavity that's just blocking the way, and you got to go in there and take it out.
Oh gosh.
So it
I
varies.
love how excited you get talking about this, and I'm over here like making faces like, okay.
The aspect of the external nose that can affect nasal function is there are 2 valves on the external nose, or valve systems really, that control airflow, and they're meant to be there. We think we've never had a direct readout from the engineer that made us, but we believe that those valves are intended to slow the air so you don't breathe too quickly, because again, the lungs don't like cold, dry air. They want warm, humidified air, and so the nose does have natural mechanisms to slow the airflow when you sniff really hard. But some people, those are kicking in with just normal breathing. And so that's because the cartilage is a bit weaker, or the orientation of it's not quite right. So when they try to breathe, everything collapses shut.
Oh gosh.
And so that's valve failure, either of what we call the external nasal valve or the internal nasal valve. And those do involve the external nose, and there are ways to go in there and strengthen them, pop them open, put some cartilage in there to support it. A bunch of different ways to do it.
Yeah.
And still keep the nose looking good.
Okay. That's why it's an art and a skill set.
Yeah.
We mentioned earlier how we're kind of seeing a shift in procedures and how people are wanting to look. Let's talk about surgeries that went bad that you've had to fix from other surgeons or something like that. I feel like that could be scary and dangerous too. So talk about working with those kind of patients and bringing those patients to you. What your skill set is with that.
Yeah, it's funny how a practice evolves. When I started out here in Scottsdale, most of what I got were the people that were injured by another surgeon. So there is a bit of a culture among plastic surgeons that they don't really want to deal with other surgeons' nightmares. So they will often just say no.
Correct.
Or I can't help you.
Listen, I had the problem when I was having children. I had to change doctors in the middle of pregnancy, and no one wanted me. So I can only, I understand the liability of it, but I needed help, right? These people need help.
I don't even know if it's liability or if they're just trying to maintain their quality of life. Because those surgeries will, you'll lose sleep at night over some of the tough ones.
can only imagine,
Either before or after, if you're just not sure, because sometimes you're reconstructing everything. I've gone into noses where the entirety of the cartilage is destroyed or missing. I've gone into faces where the layer that we normally operate on is like Swiss cheese. It just has holes in it and it's torn apart. And there are ways to fix those things. They may limit the final result of the procedure you're doing, but oftentimes the patient at that point would just be grateful to look natural.
Yeah.
So I've found in my practice that even in those complex cases, because I've been doing them for so long, I'm able to get nice natural results. So it just requires patience and it's slow dedication and a really strong surgical team that can hold things the way you want them held and can recognize the phenomenon that we're running into.
I feel like that kind of goes back to one of the first questions I asked you is about, the bedside manner and the importance of working with these patients and setting realistic expectations.
Yes.
Especially for those. Do you find it more difficult sometimes to?
It's, it's a mixed bag. I think that with people who've been harmed, they are often angry and very, almost resistant to going back under the knife. And so the first hurdle you have to overcome is just reassuring them that it's not, like one surgeon, you've met one, you met them all. It's pretty different, just like like I said, with commissioned art, if you want a Picasso, you go to Picasso.
Right.
If you want a Van Gogh, you go to Van Gogh. But Picasso can't make a Van Gogh, and Van Gogh can't make a Picasso. You know what I mean? So there's that aspect of it. And also, I believe a collegiality. If you're a person who believes, like myself, that you never know enough, you want to know more, you want to learn more, then I think you're ready to tackle those complex situations. But I think there's a lot of surgeons out there that finished their training and that was the last thing they learned, and they just sort of roll out the same stuff for their patients.
Let's talk about surgeries outside of the country and coming back in, kind of thing.
Yeah, it's a risky move. I think that's the part that people don't think about. If you go to Turkey or if you go to Mexico, or there's a bunch of sort of destination surgery places, Korea and the like. You may find a good surgeon, you may not. That's the same as the United States. So I'm not bagging on surgeons in those countries, because there are fantastic surgeons in all those places. The hard part is surgery is not Disneyland. You're not going on a ride and then going home. It's controlled injury, and it requires aftercare and monitoring. When you return to the United States, you're still freshly post-operative, unless you plan on staying there a few months. You're going to be freshly post-operative, and things may come up. And if they do, you're going to start running around asking plastic surgeons if you can be seen in their office, and most will tell you no, our office included. And the reason is that at that point, that person has had surgery. They're wanting you to manage something that you don't know anything about as a surgeon. You don't know what was done. You don't know this patient from anybody. You weren't a part of
you don't know
the original
history,
surgery.
You know nothing.
So in the world of what we do, we have only limited time in the clinic. We have only limited time in the operating room. It's really not right for a surgeon to do surgery and then say, go back to your country and find someone else to take care of it. I wouldn't ever suggest that I do get patients from other countries. I don't ever suggest that to them. And by that notion, I would just suggest if you're planning on doing that, you might need to make some trips back to that country for your aftercare.
Or stay there for months on,
Yeah, you might. It just depends on what happens.
What is the most rewarding thing you get out of your profession? I didn't finish the question before you started smiling.
Yeah.
I love that.
It's an easy answer. I like making people happy, and it's a happy business. People that come with internal motivations, they're doing it for themselves. There's a particular thing that they would like to improve because it would make them feel better. It would make them feel more confident. And then to bring them through that process and see them blossom and really lean into it and enjoy it, that's the greatest reward. Hearing how happy people are is absolutely the greatest reward.
What is your biggest piece of advice for a patient or someone, really, I want to start at the beginning, for someone potentially thinking about doing any kind of surgery?
You kind of spoiled you kind of threw a spoiler right in the beginning of this talk, because it's doctor-patient rapport is really important right off the bat. You, as a patient, have to feel like you can tell this doctor anything, including things that you don't like.
Yeah.
Or things that you might be embarrassed about, or whatever it is. You need to feel like this person is going to hear me, and they're not going to give me the brush off. They're not going to get upset, and they're going to be able to work with me on this. That rapport is essential for good care, both for the doctor and the patient. So if I meet somebody that's very closed, I've had patients sit in the chair and I say, why are we here? And I hand them a little mirror and I say, can you point out what we're talking about? And they'll say, I don't know, everything. I don't like my face. Well, I can't make you happy if you don't know what would
That's
make you
fair.
happy. You understand? So it's a two-way street of rapport and communication.
Well, I was going to ask you, have you ever, I think it would be, I would have no problem with the doctor being like, I don't think I'm the right fit for you kind of thing. Have you ever had patients, they're like, I don't want to do this with you. We're not on the same page or anything like that. Or would you, if it hasn't happened, would you as a doctor?
Oh, I say no to patients.
Okay.
There's a good percentage that I, in some form or another, will tell them, I don't think,
I
what
think it
they're-
should go both ways. If I'm
Yes.
looking for the right doctor, the doctor should want to work on me as well, in my
Yes.
opinion.
If, for example, if someone came to me and they showed me pictures of a bunch of the Real Housewives, and
Yeah.
they say, this is the look I want, I would immediately just give them a few names of people that do that kind of work.
Yeah.
And I don't keep their consult fee. I just refund it and say, have a nice day. The more difficult ones are people that are unstable, or at least they come across as unstable, and they might be doing it for the wrong reasons.
Yeah.
Because you can get into issues of concerns of safety and things like that.
Yeah.
There's a fair amount of assault and homicide against plastic surgeons by either potential or past patients that happens in the United States.
Yeah, of course.
And so you want to try and avoid that person.
I would agree.
So there's a profile of that person. I'm not going to say it on this,
Yeah, it's
but
fair.
I'll just say all of us that do this for a long time, you get really skilled at doing a bit of a psych eval on your patients to make sure their motivations are internal and their primary motivation, and that they're not under any pressure to do it from a parent or a spouse or a child, and that they're not expecting their external world to change as a result of what they're doing for their body. And those kinds of things are the red flags that you might not directly tell the patient, but you may have to just tell them, I don't think I'm the one who can
That
help
makes
you.
sense, yeah.
In rare cases, I'll just tell them, I don't think you're a candidate for plastic surgery ever. And that's because of usually a psychiatric finding.
Yeah.
Yeah.
What are you most excited about for the future at Scottsdale Plastic Surgeons?
I'm excited. I think, we've been together a long time.
That says,
all
for
of
a
us.
family to stay together that long is huge,
Yeah,
right?
yeah, we've
Because
been
they
together a long
choose to,
time.
by the way, you
Yeah.
know?
So I honestly am happy to go into work every day. I
love
work
that.
with people that I truly do love and care about.
Yeah.
And, so I really enjoy every day. I think right now, I'm just always excited to see the industry develop, and even my staff grow as people. Our surgeries, over the time that I've been doing this, I've seen a great deal of improvement even in the results we get just from small, subtle changes. But so it's kind of fun to do it all as a team,
I love that.
So I think what I look forward to is working with my people.
I love
and
that.
And my patients. I love my patients.
Yeah, I can
Yeah.
see it in your face. I feel it from you sitting here with us. This is my favorite question. I genuinely ask every single guest I've ever had. What is your favorite Scottsdale vibe?
My favorite Scottsdale vibe. I think that being in Scottsdale, I became a bit of a foodie.
Oh, okay. This is our biggest
because-
answer. So you have to tell me your favorite either cuisine or your favorite place to go.
Well, Ocean 44 is probably
Okay.
my favorite.
Well, good. We're right around the corner. Are you going for
yeah,
dinner?
it's right here. But honestly, I do like all cuisine.
Okay.
They have fantastic sushi out here. I go to Sushi Broker in North Scottsdale, and also, I used to go to Hero a lot. That's in North Scottsdale as well, but it's just not as convenient to my office as the Sushi Broker. But really anything. There's great Italian cuisine out here. There's great Mexican. They have
you
pretty
really
decent
can't go
Mexican
wrong.
cuisine out here.
Yeah.
But you got to look for it.
Okay.
The thing I enjoy, like Restaurant Week, I mean, come on,
Yeah.
there are amazing restaurants out here. Certainly, Sam Fox has made a huge impact out here, and I love his places. So, I like going to a lot of the Fox concept restaurants as well.
I love that.
Yeah.
Well, Dr. Paul Holden, thank you so much for joining me today. I love to know you and get to know you more. And I think what stands out for me most is your genuality. It's genuinely caring, and I think that shows in your practice. I love how you are an artist at the end of the day, and I appreciate that because it is a skill set. You can be taught things, but the artistic side of it that's a natural thing, and I think that takes something out. So thank you so much. So if you, as well, are looking for exceptional experience and exquisite results, please get a hold of Dr. Paul Holden at Scottsdale Plastic Surgeons at scottsdaleps.com. They are also on social media at Scottsdale_PS and Dr. Paul Holden on Instagram. You can please call him at 480-787-5815 to get your consultation and come out looking as beautiful internally as well as externally, because he says you can only do one. Remember that. Please follow them on Instagram as well, and we will have more. If you as well as are looking to interest of their small business Saturday, get a hold of us at alicia@michelle.media. All of this and more will be in the description of this episode and on our YouTube channel. Have a wonderful week, Scottsdale. Keep vibing, and I'll see you around town.